So, general anxiety disorder, or GAD, is a disorder characterized by an excessive or unrealistic anxiety about two or more aspects of life, like work, money, social media, school, family, etc. They can be big or small, it doesn't really matter. They are often accompanied by symptoms like palpitations, shortness of breath, dizziness, and sometimes crying.
So some of the characteristics of GAD can be like ongoing and constant anxiety, which is a cognitive characteristic, and another cognitive characteristic is worried about multiple uncontrollable matters. So like whether or not they're going to fail a test in the mild case, or in an extreme case, whether or not they will make it out in life. It's something that they can't really control, like the near future. And some of the other mental effects can be edginess and poor concentration from how anxious they can get. There can be some attitude changes like irritability. And for physical effects, there's stuff like fatigue, muscle tension, and even sleeping problems from the constant worrying.
As with most anxiety disorders, the symptoms of generalized anxiety disorder seem to stem from an overactive amygdala. Where this overactiveness in the amygdala comes from is subject to debate, but most models agree that it comes from childhood experiences. Whether it's from your environment or from the way that you were raised, childhood seems to play a very important factor in the development of this disorder.
GAD, treatments such as mindfulness therapy, cognitive behavioral analysis, and medication help modify potentially negative thoughts and emotions, and even manage the physical symptoms of general anxiety disorder. Without therapy, physical activities such as running, playing a sport, or other forms of exercise are good momentary relievers for general anxiety disorder. Common medications for the treatment of GAD include bustiprone, venlafaxine, and escitalopram. It is important to regularly consult an expert or therapist to make sure the conditions of GAD haven't evolved into other disorders such as panic disorder.
So, a phobia is an extreme or irrational fear or evasiveness to something. Many models believe phobias are developed through survival instinct, and an example would be that most people fear things that could kill them, kill their ancestors, like heights, snakes, and spiders.
Characteristics of phobias are mainly cognitive and behavioral characteristics. So some of the cognitive being there's like a strong fight or flight response and usually immediate fear response whenever they see the object they fear the most. And because of that, they'll act like they'll avoid that object every day in a way to avoid the feelings of being fearful. And physically, if they're exposed to this object too long and they haven't had treatment yet, they can get a panic attack just from seeing the object.
Classical conditioning is crucial to understanding phobias. When a person is placed in a life-threatening situation or a perceived life-threatening situation, they may associate a non-threatening stimulus with that reaction. This doesn't have to happen very often because our brains are biologically programmed to be afraid of certain life-threatening things like snakes and spiders.
The best treatments for phobia are exposure therapy, lifestyle change, and medication. Exposure therapy focuses on a changing response to a feared object or situation. Medications such as beta blockers can often help the adverse effects of phobias. Techniques like mindfulness exercises and including friends and family and support groups can often help bring out the best in phobias and help treat them.
Definition for a panic disorder is relatively short. So it's defined as a sudden, uncontrollable fear or anxiety, often caused by wildly unthinking behavior.
So as in the name, one of the most common characteristics of panic disorder is unpredictable and repeating panic attacks. And when they have a panic attack, the sensation feels like they're going to die. And you can't really blame the patient because physically they have palpitations, tingling hands, their body will change from hot and cold sensations, they might choke, feel dizzy and sweat, and they might even feel like they're disassociating with reality. So it kind of feels like they're about to die.
Many cognitive theorists believe that the fear of having a panic attack may make the likelihood of a panic attack more likely. According to the biological model, panic attacks stem from a faulty alarm system. The brain will think it's in life-threatening danger and react as if it is, even when there's really nothing physically threatening the person.
The main treatments for panic disorder include psychotherapy and medication. Psychotherapy is extremely effective in understanding and treating panic attacks and the symptoms of panic disorder. Medications such as Prozac, Xanax, and Zoloft help treat patients struggling with panic disorder.
Anxiety disorder is characterized by an overwhelming anxiety or excessive self-consciousness in everyday social situations. This is fairly common. You see it a lot in high school through people going through social media and stuff like that. People with social anxiety disorder have a persistent, intense, and chronic fear of being watched and judged by others and of being embarrassed or humiliated by others by their own actions. Sounds a lot like high school.
Main characteristics is disproportionate anxiety whenever it comes to social situations. So that means when they're about to meet someone new, they might avoid the crowds or avoid meeting new people because their cognitive thought process is that they'll have a negative evaluation of themselves and that they'll have a big fear of being scrutinized by other people just by messing up one small thing. So because of that, they'll avoid social situations to reduce the fear, distress, and impairment of being basically made fun of in public.
Social anxiety disorder could be operantly conditioned from overprotective parents. If a parent repeatedly enforces the belief in the child that they can't be successful in social situations by taking care of them for them, the child will never be able to grow socially. If this happens over and over again, the child may develop an overactive amygdala, according to the biological model, that makes it have a natural fear of social situations.
The main treatments for social anxiety disorder consist of cognitive behavioral therapy and antidepressants. Talk therapy is the main form used to treat social anxiety disorder, and it is helpful in managing personal fears. Venlafaxine is the most commonly used antidepressant to treat patients with this disorder. Other at-home treatments for social anxiety disorder are stress reduction skills and participating in social situations to develop a support system.
So, obsessive compulsive disorder, or OCD, is a personality disorder characterized by excessive orderliness, perfectionism, or attention to detail, and a need to control in relating to others, like checking the lock 10 times before you close the door, testing the alarm before you get out of the car, stuff like that.
So with obsessive compulsive disorder, some of the main characteristics come from the cognitive and behavioral perspective. Where in cognitive, they'll have these obsessions over whatever they need to do to reduce their anxiety. And these obsessions can be so much that it affects their behavior, and they'll do compulsive actions just to reduce the anxiety. And if they haven't had any treatment, they'll have severe stress or impairment when they try to stop the compulsion or whenever someone else tries to stop their compulsions.
Obsessive compulsive disorder may also be a result of operant conditioning. When a person with OCD experiences an obsession, they may be tempted to respond to it with a compulsion that temporarily relieves that anxiety. That good feeling will make them want to do the compulsion again and again more often every time they feel that obsession, which leads to checks and the other behaviors that characterizes OCD.
OCD is often treated by cognitive behavioral therapy, systematic desensitization, and certain forms of medication. Cognitive behavioral therapy is extremely useful for treating compulsive habits, where systematic desensitization is often used to compress the OCD or withhold it altogether. Common medications for OCD include buciprone and venlafaxine. Although OCD cannot be fully treated, compulsions can be reduced through continual therapy and understanding of peers and therapists alike.